Hey guys, Dr. Ben here to give you your wellness tip of the week. So we're going to start doing these wellness tips of the week every week. It's going to be filled with good new content, all the latest research on what it takes to really get and stay well. So the topic today is about vitamin D. A lot of you guys have heard about vitamin D. We traditionally know of it as being the bone vitamin. So if you want strong, healthy bones, you got to have lots of vitamin D. Well, there's much more to the vitamin D picture than just bones. So vitamin D is involved in just about every process in the body. Over 200 enzymatic processes inside your body. Vitamin D plays a very crucial role. The focus today is on vitamin D's role in cancer. This was taken out of 275 epidemiological studies, and what they found was that vitamin D is inversely related to cancer. So what that means, the lower your vitamin D levels get in your blood, the higher your risk of cancer. In this particular study, they showed that if you get your vitamin D levels between 40 and 60, which is nanograms per deciliter, you really just need to know between 40 and 60, then you reduce your risk of, we could cut 58,000 new cases of breast cancer every single year. We could cut 49,000 cases of colorectal cancer, and get this, you cut the death rate from those cancers by 75%. So literally, we could almost cut breast cancer and colorectal cancer by 75% just by optimizing our vitamin D levels. It's the simplest thing in the world to do. There's several ways to do that. Number one, and the way we're designed to do this, the way God designed us to do it, is from the sun. So we're supposed to get our vitamin D from the sun. Unfortunately, between about October and March, we get no sun. In fact, maybe hanging the arm out the window while we're driving to work. For the most part, that's pretty much it. So in those months, you have to supplement. We have to supplement to get our vitamin D levels. Now, this study says between 40 and 60, but most of the recent research says your vitamin D level should be more like 80. So anywhere between 80 and 100 nanograms per deciliter not only affects your rates of cancer, but it helps type 2 diabetes, it helps Alzheimer's, heart disease, depression. Anyone ever heard of seasonal affective disorder? That tends to happen in the winter months when we get less vitamin D because we're not getting sun exposure. Another important component of vitamin D is the relationship between vitamin D levels and flu. When you think about it, when do we get the flu? What time of year? It's in the winter months, right? Between October and really up until February or March. When do we get less sunshine? And that happens to be in that same time frame. So it's not really a coincidence that as our vitamin D levels get lower because we get less sun exposure, we also have higher rates of colds and flu. It's not some magical virus that hides in our closet until the weather cools down and then jumps out and attacks us and then disappears during the summer months. It's something that's here all the time. It's just our immune systems are able to manage it based on our vitamin D levels. The other thing we tend to hear a lot about this time of year is flu shots. You can't walk into Walgreens or Kroger. Heck, you can't even turn on the TV anymore without seeing an advertisement for flu shots. When you look at the data, and this may come as a shock to a lot of people, but when you really look at the data, according to the Cochrane Library, the Cochrane Collaboration, they do what's called a meta-analysis where they look at all the available data that's out there, and they found that for every 100 people that get the flu shot, only 1.5 benefit. So that means 98.5% of the people that get the flu shot get absolutely no benefit. And the big shocker is the flu shot is still one of the shots that contain what's called thimerosal, which is the ethyl form of mercury. So when you get your flu shot, you're getting a nice dose of mercury. It's about 25 micrograms of mercury, which according to the EPA is more than a 550-pound man should ever be exposed to. So if you want the flu, get the flu shot. There was another good study done with about 2,200 people over 3 years, and they found that supplementing with just 2,000 IUs of vitamin D almost eliminated their risk of colds and flu. So it's very simple to do. We can all do it. On average, the average adult in America needs to supplement with between 5,000 and 10,000 IUs of vitamin D3. Now for our kids, roughly if it's a 5-year-old kid, anywhere from 2,000 to 3,000 units of vitamin D. Ideally though, you go off of your blood test. So everyone should get their blood tested, and again, it should be between 80 and 100 nanograms per deciliter. So let's get out there, let's get our vitamin D levels up. Ideally, we spend 30 minutes every day in our bathing suits outside, but that's not going to happen over the next few months. So you got to supplement. If you need any help, go to our website. It's 180well.com, or you can email me directly at drben@180chiro.com. Again, God bless.